sternocleidomastoid originates at the manubrium clavicle and is inserted into the mastoid process of the temporal bone. The action is a rotation, and it turns your head to make sure people are out of the way of the barbell when re-racking. This muscle is the temporalis. It originates in the frontal, parietal, and temporal bones. It inserts into the mandible, and the action is it elevates the mandible. This will keep your jaw up so you don't hit your jaw on the barbell. This is the trapezius upper. It originates in the occipital bone and it inserts into the lateral 1/3 of clavicle and acromion process. The action is elevation and it will move the barbell up above your head. This is the deltoid anterior. It originates in the clavicle. It inserts into the deltoid tuberosity of humerus. The action is a shoulder flexion and medial rotation of humerus, and it brings the barbell up and over your shoulders. This is the latissimus dorsi. It originates in the T7 through L5 vertebrae, ribs 10 through 12, and the iliac crest. It's inserted into the intertubercular groove of the humerus and is an abduction. It brings the barbell back down onto the rack. This is the spinalis thoracis. It originates in the T11 through L2 vertebrae. It inserts into the T3 through T7 vertebrae, and the action is retraction. It will bring your back when picking up the bar.
Even if you're just watching, you know what I mean, you'll be able to learn. I don't know anywhere. Yeah. We'd love to.
This is the flexor carpi ulnaris. It originates in the humerus. It inserts into the carpals and metacarpals. It is an adduction, and this will help you to grip the bar and flick it backwards when needed. This is the vastus medialis. It originates in the femur, inserts into the tibia. The action is a knee extension, and this will be used to come up from the squat. This is the rectus abdominis. It originates in the pubis. It inserts into the ribs 5 through 7 and sternum. It is a flexion, and this will compress your abs to help keep yourself stable. This is the extensor hallucis longus muscle. It originates at the fibula and inserts at the big toe's proximal phalange. The action is a flexion of the toes, and this will help to keep you level when walking with the barbell. This is the flexor carpi radialis. It originates in the humerus. It inserts into the metacarpals. It's an abduction, and these will also help to grip the bar and flick it back. This is the digitorum profundus. It originates in the anterior surface of ulna. It is inserted into the palmar surface of the phalanges 2 through 5. It is a flexion, and it makes the hands grip the barbell. This is the vastus intermedius. It originates in the femur, inserts into the tibia. The action is a knee extension, and this will be used to explode up from the squat. This is the gastrocnemius. It originates in the femur, inserts into the tarsal. The action is a knee flexion and plantar flexion at the ankle, and this will be used to push the barbell up by raising the whole body. This is the soleus. It originates at the tibia, inserts at the calcaneus. It is a plantar flexion at the ankle, and this is used to come up from the squat and explode up to get the weight up. This is the anterior talofibular ligament. It originates at the fibula and inserts at the talus. The action is a plantar flexion of the ankle joint, and this is used to keep stability in the foot and help to raise the heel. This is the adductor pollicis. It originates in the palmar base of the 3rd metacarpal bone. It inserts into the base of the 1st proximal phalanx. It is a thumb adduction, and this makes your thumb grip around the barbell. This is the external abdominal obliques. They originate in the ribs. They insert into the coxal bone, and the action is a lateral flexion. This will compress your abs to help keep your back straight.